We have the vice chair. We have Lillian Posadas. We're going to go to
Oh.
Lillian Posadas real quick. Calling an audible.
Yeah.
Lillian Posadas. Let's bring on hospital administrator Lillian. Thank you so much for joining us. Always, we'll just stop everything to get you on. And we know you don't have a lot of time, so if we could just get right into it, and we'll start with the COVID census count at the Guam Memorial Hospital this morning.
Okay, we have 50 currently in the hospital, and of the 50, 12 of them are at the ICU level of care. And of the 12 ICU patients, 11 of them are on ventilator support. But of course, you heard that the news that we lost one individual early this morning.
Was that individual on a ventilator, Lillian?
No, he wasn't on the ventilator.
How about the death we reported last night?
That one was on the ventilator. Yes, the individual was on the ventilator.
Any update on the SNU?
No update, no movement. We're still, challenged with our staffing situation here in the acute side. 13 RNs are out because of the COVID. And so we do have I believe now we have 14 critical care nurses from the DOD EMAC and one certified nurse, registered nurse anesthetist. And so they're boots on the ground. They're working 12 hours in the ICU and also in the emergency room and in the other COVID care units. And so, they're really a big help.
Can we go back to the 13 RNs out? Are they COVID-19 positive, or are they just being sidelined waiting for results? Or
No, they were COVID. They were tested and they were COVID-19 positive. Some of them are just out on different type of personal sick calls. So, they're exhausted. So
When did they go out? I mean, is
Yeah,
this
what-
recent?
what's the
the
timeline?
13 registered nurses go out.
Yeah. What?
I don't have the exact day, but you had asked me that question, how many are out? So I'm now responding with that information that as of that time that we talked, 13 of the registered nurses, altogether 42 staff tested positive with the second wave.
In the second wave. So can we get the breakdown, Lillian, of nurses, doctors, and non-medical staff?
I don't have the number right now
Okay.
for you, Chris, but I can get that number. But right now, as far as the registered nursing category, 13 were still out. Some of them who have tested positive have recovered and have been cleared by our employee health and infection control and public health. They've been cleared to return to work.
That's
So
good.
we have gotten some back.
Lillian, we got the help from the DoD side with those nurses that you had mentioned, but we're still seeing this concerning climb in deaths and hospitalizations. I know that when we had talked about these people coming, it was help is on the way, and I don't want to take away from anything they're doing, but did they just come in so late in the game, where so many of these COVID-19 cases were already on the decline, that there was really nothing they could do from an acute care standpoint?
Okay, let's split that up, that
Right,
question. You
right.
said the DOE nurses?
The DoD, the FEMA, right.
Okay. Well, when we submitted our request through the federal, we immediately got a response. And so, they came in pretty quickly. Now, as far as was it a bad time or was it the right time? We were really, because our census kept going up and our staffing was going out. So, that was the trigger point for us. We need help. And when we asked for it, we got it right away without much of any delay. So
Right.
we were just, I mean, perhaps we should have requested sooner, but we're just so stretched out with doing many other things. But when we finally submitted our request, we got a very good response. And so we requested actually for 36 CCRNs. We got half of them here. And so we're in discussion to keep them more than 30 days because, that was the plan,
Right.
was them to be deployed here to GMH to help out with the crisis for 30 days.
Right.
And our plan, long-term plan, is to get get a company, from off island to bring us an infusion of critical care nurses. So we're in discussion with that company. and we're hoping to come to some kind of a final agreement
Lillian,
Yeah.
by next.
I gotta ask because I interviewed the mayor of Assen. Tragic story. His daughter taken to the GMH last Friday. Diabetic, COVID-19 positive, complaining shortness of breath. She was released the same day, and I'm sure you know the rest. Died over the weekend, pronounced dead on arrival at GRMC. The mayor did not want to point fingers over to you guys at the hospital, but I asked him, I said, if GMH had admitted your daughter, do you think she would still be alive? And he said yes. So I got to ask, how do you respond to that?
Well, there's really no guarantee, but according to the records in the emergency room, and I can't really disclose too much because of HIPAA, the individual was seen at 10 p.m. That evening and was evaluated by the emergency room doctor. They did some diagnostic procedures, EKG, X-ray, some lab work, and the oxygen level was at 97%. So it's still good. It's an indication that the respiratory system she was aerating and oxygenating very well at 97%. So based on whatever clinical findings and the results and following the CDC algorithm, the doctor determined that the individual did not need to be hospitalized. And so she was released home at 4 o'clock in the morning.
Lillian, do you think that this kind of shows, and we've had doctors, we just had Dr. Cabrera on yesterday. He said, hey, with the COVID-19, you could be okay today, tomorrow, accelerate quickly. This thing just burns through people with pre-existing comorbidities. Is that what you think happened in the case of Jasmine Salas?
I can't make that opinion or judgment because I don't really have all the facts. But we've seen it here in the hospital where patients are stable, and yes, they can crash.
Do you
As
have
Dr.
do you have an update on the investigation into the nosocomial infection?
Okay, the one individual who is a registered nurse, is that what you're talking
Yes.
about?
Yes.
Okay. I don't have the official report, but preliminary verbal report from the infection control investigator is that, yes, she contracted the COVID infection here in the hospital. Where and how she contracted it is still being traced because she had many visitors. At the time that we still were allowing visitors, she had friends and families come and visit her. So we don't really know exactly if that may be the point where she contracted the infection. So that I don't have that data with me right now because there's still some cases with the tracing. There's still some cases that are popping up.
Right.
Are you guys because if it turns out that it's visitors into the Guam Memorial Hospital, are you guys doing anything to revise your protocols for people that are visiting people at GMH?
We're not
And-
allowing visitors right now.
Right.
Ever since we went into PCOR 1, visitation privileges are suspended.
I see.
We're only allowing like a parent of a pediatric individual to be with the patient, COVID or non-COVID. We're allowing family members of patients who have dementia or are high fall risk, if they can help, watch their loved one, so that way minimizes the risk for fall or confusion in the hospital.
Right.
And so those are the kinds of family members we are allowing into the hospital.
Are they being tested for the virus before they're allowed
We're
into
not
the...
testing them. We are checking their temperature when they come in. We screen them for, questions such as, have you had any symptoms? Have you had any history? Have you been tested recently? Have you had a history of a COVID positive result? So we're screening them, an assessment, but we're not actually testing them.
Where are we with discussions about GMH being strictly all COVID in hospital and GRMC non-COVID? Is it still what it was a week ago when we spoke that we can't move the was it pediatrics ward and
Yeah.
Maternal child health
Yeah.
population service, right? Yes, we we continue to provide the services for maternal child health, laboring mothers, and after they deliver, we continue to, care for them here, provide the service in the postpartum OB ward, and also of their newborn in the neonatal intensive care unit. If the infant, needs to be in a neonatal intensive care unit, we service them here, as well as if they're, needing to be on oxygen, intermediate level of care in the nursery. But for most of the well babies, we have them room in with their moms, and then once they're all stable, they go home. Pediatrics, we have cut back on the number of beds because we were seeing for a while there that the pediatric inpatient admissions were very low. There was a period of time when we did not have any pediatric patients in the hospital.
That's good.
So we were utilizing the staff in all the other areas, such as, the COVID areas and non-COVID areas. We still have our medical surgical unit and, a small number of telemetry beds for non-COVID patients who need telemetry. And, so we have non-COVID inpatient beds. We are seeing a spike in pediatric admission. So
Why?
that's something that we are now discussing with the doctors and our chief medical director. We're discussing to see, okay, maybe what we need to do now is, change plans and see what we can do to then, because, we're going to expect it's flu season. And we'll probably see an increase in pediatric admissions.
Right.
When you say,
That's the issue that we need to address.
you said you are seeing an increase now. Is that what you
Yes.
said? Are they COVID patients?
No, they're non-COVID
Okay.
pediatric.
Okay. Lillian, so we know that you're not accepting visitors now, except for in those certain cases that you had mentioned. They're not being tested, though. But when we go back to PCOR 2 or PCOR whatever, when you do start allowing visitors, if we're concerned that a visitor may have brought COVID-19 into the hospital and infected a patient, are you planning to adjust the protocols in a more relaxed PCOR setting?
It really all depends, Chris, on what we're seeing, and the numbers continue to rise in the community of people being positive. And so that may impact our decision on the visitation, even if we go into PCOR 2 or PCOR 3. It just really is going to depend on what's going on.
Right. From an infection control standpoint, because we've had this lady dropping in the comments a bit. Can you talk about, so we have the COVID part, simplification. We have the COVID part of the hospital, the non-COVID part of the hospital. Is there traffic from staff, nurses, doctors working in the COVID side to the non-COVID side, and how do we mitigate the risk of transmission?
No, if we assign nurses from other areas, from the non-COVID areas into the COVID, we make sure that they stay in that area. They don't go back and forth.
Okay.
Once they're done with that shift, they go through the proper doffing, clearing, decontamination and all that before they go back out. And so they're given a hospital gown. They don't go in there with their gown that they use in the non-COVID area. They go in with a different gown, donning all that PPE gear and all the PAPRs, protective gear. And once they're in there, they stay in there. They don't go in and out until they're done with their shift.
Lillian, I wanted to follow up on the DOD nurses. You said that there were 14, right? If any of the DOD personnel that flew into Guam, if any of them came down with COVID?
Not that I know of. They were tested before they started, and so we haven't heard anything that one of them is manifesting symptoms and needs to be tested. I have not heard that at all. I haven't received that, and I don't know, if you heard it.
No. I just
No,
wanted
yeah.
to ask. And so I know that so phase one was that you'd get these 2 intensivists, the 15 nurses and the 4 respiratory therapists. And then from what I understood, based on need, if you needed more personnel, you could go up to 36 CCNs and 4 physician intensivists and 8 respiratory therapists. You just needed to make that ask. And so
Right.
have you made that ask? Do we need to ask for more people to come to Guam from DOD?
We haven't officially, but we've had discussion with the powers that be, the possibility. But we also have to take into consideration that there are other hospitals that need also additional resources. So, what we're thinking is perhaps maybe what we with given what we have, they're here for 30 days. We may need to extend their services another 2 or 3 weeks since they've gotten already kind of acclimated. They're doing very well according to the physicians, the COVID physicians. They're acclimating very well. They're very receptive to how we do things in this facility, and so they're doing good. And maybe what we need to do is rather than have a new group come in and do all that orientation and training, we keep what we've got and just extend them.
And just as a follow up to the SNU, is the reason why we are not seeing that facility occupied is because we just cannot get the staff up there, despite the fact that we got the DoD medical team here, we got the 6 combat medics, the 15, 16, 17 GDOE nurses. We just don't have people to staff SNU.
So we're focused on the acutely and critically ill individuals that come into the ER. They continue to come in, and so we're focusing our resources in that area.
Right.
In the emergency room, we still have people holding and waiting to get into an inpatient bed. So that's where our energies have been and our attention of the resources, because we really have really sick people coming in.
Right.
Every day we're doing, we're intubating patients. Every day we have a cold blue incident in the hospital.
Right.
So these are really, really sick individuals that are coming in.
And Lillian, the correct me if I'm wrong, but with the SNU, I remember you had said that would be not for the acutely ill, but more for the middle
Low
of the
level,
road.
yeah, we still need to continue isolation, correct. And,
Right.
By experience, we've seen people, even though that they're stable, they tend to turn around and they crash.
Right.
So we're being very cautious about that.
It's just
too.
not a good call right now. It's just what you're saying.
Yes, it's not a good call right now.
Well, we got this 9/11 ceremony coming up, but I wanted to, Bree,
No, I'm just feeling for you guys.
yeah, I feel for you, but I got to ask about this CMS report that came out a couple days ago, found the hospital at fault and some patient deaths. Lillian, could you just address that for us?
Okay, it didn't come out a couple of days ago.
I mean, yeah,
That
a
was
while ago,
last
yeah,
year.
right.
When the surveyors were here last year, and so they did find some deficiencies in terms of. Are you talking now about the pediatric?
Yeah, yeah.
Okay, okay. So they did. They cited us with that, and we did our plan of corrective actions. We submitted it, and they accepted it. They approved it.
Right on. Lillian, heading into a weekend here, you guys are in over your heads. The hospitalizations, as predicted, have continued to climb. The deaths, I mean, we've seen one every day this
Yeah.
week. I got to give it to you in closing. What's your message to the people of Guam coming from the GMH and the frontliners?
Again, please continue to exercise the precautionary measures, to social distance, to wear your mask at all times. And, if you need to congregate with just a small amount of people. And again, keep your distance from each other.
Are we
Protect yourself.
Are we anticipating any more death announcements today, Lillian? Because I feel like I got to ask you while we have you here.
Well, I don't want to say that
Right.
because, I don't want to, but the people, again, like I said, are very, very sick, critically sick. So anything can happen, and, hopefully not.
Right.
Let's pray hard that they will, heal and recover from this deadly virus. But it's just unpredictable.
We've been praying and we'll continue to do. So.
Thanks, Lillian, for your time
God
again.
bless you, Lillian. Be safe.
Okay.
Take care. Be safe.
Okay,
Thank
we'll see you on Monday. Okay, there you go. Lillian Posadas, hospital administrator. Yeah, if you could come on Monday. She's like
Yeah.
this, boy. I see Bo back. Wait, what was that? What was that? Thank you, Lillian.
Get some rest.
Okay, yes,
Hopefully you
yeah.
can.
Okay, 8:25. We got to take a quick break, and we're coming back. This is what's coming up on the rest of the show, though. We have a 9/11 virtual